stand before you today to host the International Women's Day activity by Manipal Hospital's Whitefield cluster. माँ, बेटी, सोसे, मगलू, नानी, देवी. Does this recall anything at all? These are the various roles a woman plays during her life. Women play a crucial role in balancing work and family responsibilities. We are truly incredible beings who often take multiple roles at once. Our unwavering dedication and selflessness are truly inspiring. So, let us celebrate the women in our lives today and every day. Let us honor their strength, resilience, and compassion. Let us continue to work towards a world where women are treated with dignity, respect, and equality they all deserve. With this, I request you all to witness a small video by our unsung heroes who are the Manipal Sakhis of Manipal Hospital's Whitefield. Can we have the video, please?
When we look at history, we see countless examples of women who have shattered barriers, broken stereotypes, and paved the way for future generations. Today, on International Women's Day, we at Manipal Hospital's Whitefield aspire to inspire you by narrating the journeys of some of the unsung heroes among our patrons in and around the Whitefield area of Bengaluru. Being one of the oldest and historic neighborhoods in the city of Bengaluru, Whitefield has emerged as a large IT hub. And with rapid growth comes the need for access to world-class healthcare services, which is catered to by the prestigious Whitefield and Varthur Road units of Manipal Hospitals, along with Brookfield Clinic. Together through these establishments, we have treated more than 4 million patients across various disciplines. This video is dedicated to honoring the brave women who conquered their ailments while being treated with us at these units. They inspire us, empower us, and make us believe that anything is possible. Take the case of a 10-year-old girl, Yukta, whose liver gave up on her due to jaundice at an age when a child is just beginning to appreciate the gift of life. Yet her resilience and strength, along with the tireless dedication of our transplant team, prevailed as she successfully underwent a liver transplant and is well on her way to blossoming into a strong young adult. For someone fighting for her life to someone fighting to make her identity, 25-year-old Dr. Pamela, with severe spinal issues, was unable to sit due to spondylitis and disc degeneration, which debilitated her, and she was on the verge of giving up on her career. With a successful TLIF surgery, along with disc grafting performed by our spine team, she has regained a normal life and can dream again of achieving the career she always wanted. Speaking of making careers, there are several cases of women in their 30s opting to delay bearing a child for several reasons. In such cases, consulting with our fertility specialists for oocyte cryopreservation or egg freezing, followed by IVF, has been a boon to young women who are either unable to conceive due to hormonal issues or do not wish to bear a child to prolong their careers, yet would want to experience the gift of pregnancy later down the years in an advanced age. But what if, as a woman, the gift of bearing a child itself becomes uncertain? For Miss Kavita, being diagnosed with ovarian cancer was one such difficult experience. Gynecological cancers are quite prevalent among this age group of 40s and can take a toll on one's mental health. But as she emerged victorious, the laborious efforts put forth by herself and her team of oncologists who have always recommended regular screening, all seemed worthwhile. And she can now call herself cancer-free. Women in their late 40s and into their 50s go through several perimenopausal and postmenopausal issues, ranging from fibroids, benign tumor, uterus prolapse, etc. Mrs. Diwan, being one such candidate, consulted with our team of obstetrician and gynecologist and underwent a hysterectomy for treating her conditions. She is now much relieved, knowing that she is now free from the symptoms that were plaguing her for several months. Urinary incontinence, pain and bleeding is also very common among women of this age group and can be effectively treated by specialized urologists using their non-surgical and invasive treatment methods depending on the condition, empowering older women to spend their day normally, devoid of embarrassing difficult situations. And finally, what could inspire one more than a tale of heroism spanning an entire generation gap, as is the case with 70-year-old Nine Das, with her granddaughter fighting for her life after an earlier failed kidney transplant. Notwithstanding being reduced to a spectator to her ailing precious angel, she turned to be her guardian angel, volunteering to donate a kidney at the ripe age of 70, much to the surprise of our urology team, who left no stone unturned in accomplishing this feat successfully. From the unsung heroines who quietly go about their daily lives at home, to the corporate trailblazers who have made their mark on the grand stage, and some beyond old age, a woman can inspire another in some unique ways. Today, we pay tribute to the countless women who have made a difference in our lives and the lives of others.
Hey. Yeah, you could just. Table and chair. Chair remove karo. So thank you. Can we have the other three also joining the
So I'm Dr. Sanjeev Rohatgi, and I'm the lead consultant of liver transplant at Manipal Hospital, Whitefield. The message I would like to give today is that the pediatric, the case which I showed today was the pediatric who required a pediatric patient who required a liver transplant. So what we normally see is that once the children are very young, they are not that emotionally attached to the family, and they think that the family thinks that why to invest in getting a transplant for the children. So, which is something not right. When we have when we have brought a child in this world, we should take full care of the child. And pediatric liver transplant is very much feasible, and they have a better outcome if we do if they take the liver transplant well, and the initial glitch is overcome, then the long-term life of a pediatric patient is far better than adult patient. So I would say that we should push the pediatric patients for liver transplant, try to help them. There are so many of organizations which help for the pediatric liver transplant. In this case, we raised around 8.5 lakhs by crowdfunding. Then the companies and even the doctors, everybody tried to help in some way or other and made it successful.
इनके बच्चों को जो है आप कह रहे हैं कि बच्चों का जो लीवर ट्रांसप्लांट है वो हो सकता है और इसे
बच्चे हमने सबसे छोटा बच्चा 7 महीने का किया है इधर, और 7 महीने से लेके 73 ईयर ओल्ड तक का भी ट्रांसप्लांट किया है. लेकिन अगर आप देखें तो अगर 7 मंथ्स का बच्चे को अगर हम ट्रांसप्लांट करते हैं तो उसकी लाइफ कितनी अच्छी होगी, है ना. और उसकी तो ही हैज़ अ फुल लाइफ टू लिव.
कौन ट्रांसप्लांट करेंगे सर इनको, कौन डोनेट करेगा?
Generally same as Dr. Ravi Shankar said, mothers are the ones who come forward, but in the 7-month kid which जो हमने किया है उसमें उसके फादर ने दिया, तो मदर का लिवर फैटी था. तो वी लुक इनटू whose liver is good. So it is not that who is donating, we make sure that the liver is good, and either mother or father, uncle, so everybody can donate, because in बच्चों में we need only a very small amount of liver, 150 to 200 grams, and normally people like us will have maybe 1 kg of liver, 1000 to 1200. So 200 grams is not going to make much difference, but it is different from the kidney transplant. Kidney transplant, we take 1 kidney out. Here we take only small amount of liver out for children. And in children, the cadaveric transplant, we have now started splitting. जो पूरा लिवर होता है तो पूरा लिवर का ज़रूरत नहीं होता है एक एडल्ट को, उसको भी आधे लिवर से काम चल जाता है. तो जो हम कैडावर का जो पूरा लिवर मिलता है, अगर अच्छा क्वालिटी का है तो उसको स्प्लिट करके छोटा सा पोर्शन किसी बच्चे को दे सकते हैं, उसकी लाइफ सेव कर सकते हैं, और बड़ा वाला जो पोर्शन है वो एक एडल्ट को दे सकते हैं. सो दिस इज़ वेरी कॉमन, एंड यूके में भी सब ऐसा, यूके में, यूएस में, एवरीबडी इज़ डूइंग दिस.
I am Dr. Rajshekhar Sijaka, consultant surgical oncologist and robotic surgeon. The message I want to give today, आज मैं मैसेज जो देना चाहता हूँ, women are the backbone of every family or our country, because we know that they are very dynamic and handle everything in life. But unfortunately what has happened, they don't come out with their problems. Cancer is such a dreaded disease. If you don't come at the right time, then it will take away their life. And if one single woman is affected in a family, then whole family is affected. So, and luckily breast cancer or ovarian cancer or cervical cancer, women don't want to tell that they are suffering from this one. Shyness ज़्यादा है. They feel shy that I don't want to tell it to anyone in the family. That they have to come out. They have to come out of this shyness, because everything, even if it is a cancer, it is a health problem which can be solved. Now cancers are curable. Instead of losing 90,000 lives per year, 90,000 lives we are losing in India every year for cervical cancer, and every 8 minutes one woman is dying of breast cancer in India. So when this is the alarming incidence, so if they come in early stage, definitely we can cure. One more thing is, there is a screening method only for women cancers. Actually males don't have any screening, standard screening internationally accepted, मगर women के लिए breast cancer के लिए मैमोग्राम है, और cervical cancer जो uterine का टिप कैंसर होता है उसके लिए we have pap smear and HPV testing. And one more most important thing is, we have a HPV vaccine which will prevent cervical cancer. Before 15 years, 9 to 15 years girl को 2 doses, and 15 to 45 years 3 doses of vaccine if you give, then we can prevent cervical cancer. So 2 most common cancer in a woman we can detect early, cure, or we can prevent with a vaccine. So I urge all the women to come out, take vaccine, or come out when they have symptoms, and we can cure them.
ಅಂತಾರಾಷ್ಟ್ರೀಯ ವುಮೆನ್ಸ್ ಡೇ ಈ ದಿನಾಚರಣೆ ನಾವು ಹೆಚ್ಚಾಗಿ ಮೂತ್ರದ ಅನಿಯಂತ್ರಿತ ಮೂತ್ರದ ಸೋರಿಕೆ ಅದ್ರ ಬಗ್ಗೆ ಇವತ್ತು ನಾವು ಮಾತಾಡಿದ್ವಿ. ಅದರಲ್ಲಿ ಏನು ನಾನು ಹೇಳಕ್ಕೆ ಬಯಸ್ತೀನಿ ಅಂತಂದರೆ, ತುಂಬ ಜನ ಹೆಂಗಸರು ಇದನ್ನು ಬಹಳ ವರ್ಷಗಳಿಂದ ಅನುಭವಿಸ್ತಿರ್ತಾರೆ. ಅದನ್ನು ಯಾರು ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಹತ್ರ ಹೇಳ್ಕೊಳ್ಳೋದಿಲ್ಲ, ಮತ್ತು ಡಾಕ್ಟ್ರ್ ಹತ್ರ ಅಂತೂ ಹೇಳ್ಕೊಳ್ಳೋದು ಇನ್ನೂ ಬಹಳನೇ ಕಮ್ಮಿ. ಆದರೆ ಬಂದಮೇಲೆ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗುತ್ತೆ ಇದಕ್ಕಿಂತ ಬಹಳ ಸಿಂಪಲ್ ಪರಿಹಾರ ಇದೆ, ಭಾಳ ಆಗೋಂಥ ಅವಕಾಶ ಇದೆ ಅಂತ ಹೇಳಿ ಆಮೇಲೆ ಗೊತ್ತಾಗುತ್ತೆ. ಅದರಿಂದ ನಾನೇ ಹೇಳಕ್ಕೆ ಬಯಸ್ತೀನಿ ಅಂತಂದರೆ, ನೀವು ಇದಕ್ಕೆ ಬಂದಾಗ, ಈ ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ ಬಂದಾಗ ನಿಮ್ಮ ತೊಂದರೆಗಳನ್ನ ಸರಿಯಾಗಿ ಹೇಳ್ಕೋಬೇಕು. ಪ್ಲಸ್ ಬರೀ ಡಾಕ್ಟರ್ ಬರೋದು ಅಷ್ಟೇ ಅಲ್ಲದೆ ನಿಮ್ಮ ದಿನಚರಿಯಲ್ಲೂ ಆದಷ್ಟು ಆರೋಗ್ಯವಾದಂಥ ಲೈಫ್ ಸ್ಟೈಲ್ನ ಫಾಲೋ ಮಾಡಬೇಕು, ದಿನಚರಿನ ಫಾಲೋ ಮಾಡಬೇಕು, ಹೆಲ್ತಿ ಫುಡ್ ತಿನ್ನಬೇಕು, ತುಂಬ ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವಿಟಿ ಮಾಡಬೇಕು. ಯಾಕೆಂದರೆ ಬೊಜ್ಜುತನದಿಂದ ಈ ತೊಂದರೆಗಳು ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಅಥವಾ ಮಲಬದ್ಧತೆ ಕಾನ್ಸ್ಟಿಪೇಷನ್ದೇ ತೊಂದರೆ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಅದು ಎಸ್ಪೆಷಲಿ ಈ ಮಾಡರ್ನ್ ಲೈಫ್ ಸ್ಟೈಲಲ್ಲಿ ಸ್ಟ್ರೆಸ್ಸಿಂದ ಈ ತೊಂದರೆಗಳು ಇನ್ನೂ ತುಂಬ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಇದು ನಾನು ವುಮೆನ್ಸ್ ಡೇ ದಿನ ಎಲ್ರಿಗೂ ಹೇಳಿ ಬಯಸೋಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ.
लेडीज़ हेल्थी है तो होल फैमिली हेल्थी रहेंगे. सो एवरी ईयर 40 ईयर्स के बाद रेगुलर हेल्थ चेकअप करना है. लाइक स्कैनिंग, अल्ट्रासाउंड इज़ अ मस्ट. फिर ब्रेस्ट कैंसर रूल आउट करने के लिए मैमोग्राम करना है. सर्वाइकल कैंसर रूल करने के लिए सब पैप्समेयर रखना है, और ब्लड टेस्ट, यूरिन टेस्ट सब करना है. सो एवरी ईयर ये करने के बाद इफ़ एवरीथिंग इज़ नॉर्मल, डरने का बात नहीं है, यू विल बी हेल्थी.
तो अगर कुछ तकलीफ़ें हैं, मसले हैं, तो कैसे डील कर सकते हैं?
यूजली 40 ईयर्स के बाद मोस्ट ज़्यादा से लेडीज़ को ब्लीडिंग का प्रॉब्लम होते हैं. सो ब्लीडिंग रहने से हम वो क्या रीज़न्स, अलग अलग रीज़न से ब्लीडिंग हो सकते हैं. फाइब्रॉइड के वजह से, पॉलिप के वजह से, एंडोमेट्रियल प्रॉब्लम के वजह से हो सकते हैं, कैंसर के वजह से भी हो सकते हैं. सो हम वो रूल आउट करना है, तब हम इन्वेस्टिगेशंस करेंगे. एंड मेडिकल मैनेजमेंट, दवाई से ट्रीट कर सके तो पहले दवाई से ट्रीट करेंगे. वो नहीं हुआ, वो सक्सेस नहीं हुआ तो ही हम सर्जरी करते हैं.
अवेयरनेस की कमी भी देखने को मिलती है, खासकर ख़वातीन की जब
अवेयरनेस, कैंसर सब अर्ली डिटेक्शन इज़ द बेस्ट. सो अवेयरनेस कम रहने से वुमेन अब वाइट डिस्चार्ज है, क्या प्रॉब्लम है, ब्लीडिंग का प्रॉब्लम है, तो वी जस्ट डिले कमिंग टू अ डॉक्टर. सो इस कुछ प्रॉब्लम रहने से फर्स्ट यू हैव टू मीट द डॉक्टर, गायनेकोलॉजिस्ट को मिलना है. उसके बाद वी विल सी व्हाट बेस्ट कैन बी डन.
सो लेडीज़ के जो स्पाइन या फिर बोन्स होते हैं, उसको हमको कंसिडर करना चाहिए कि ये एक बोन बैंक है. तो जितना हम बचपन में और थोड़ा सा जैसे 15-16 साल 20 साल तक की उम्र में इसमें इन्वेस्टमेंट बहुत इम्पॉर्टेंट है. जैसे किसी भी बैंक में डिपॉजिट करना ज़रूरी होता है. लॉन्ग टर्म रिटायरमेंट में रिटर्न्स अच्छे आने चाहिए, या फिर रिटायरमेंट लाइफ ठीक होना चाहिए. उसी की तरह लेडीज़ के जो बोन्स होते हैं उसको बैंक की तरह ट्रीट करना चाहिए. अच्छा डाइट, लेडीज़ को सन एक्सपोजर, स्पोर्ट्स एक्टिविटीज़, ये बहुत इम्पॉर्टेंट होता है. कैल्शियम इंटेक, विटामिन डी इंटेक, और इम्पॉर्टेंट है डाइट, बहुत इम्पॉर्टेंट है.